Go.
Imagine one day waking up and not being able to communicate with your child as easily as you used to, or not at all. Was it caused by genetics or by some other factor like infection? Today I hope to inform you about hearing problems in children. Because I suffer from hearing loss, I'm curious about this topic and I've spent a lot of time researching it. In my speech today, I'll talk to you about the 3 types of hearing loss, causes of hearing loss, how to identify hearing loss, solutions and improvements, and why sometimes these solutions don't work. There are 3 types of hearing loss. Conductive, which is caused by interference in the transmission of the sound in the inner ear. This is most common in children and infants, and in most cases it's only temporary, mild, and can be treated with medication. Sensorineural is a malformation, disfiguration, or damage to the inner ear, which is your cochlea. It is most common to be born with this, but in some cases the hearing loss is progressive and unilateral, meaning in one ear. This type of hearing loss is typically hereditary. Mixed hearing loss occurs when both conductive and sensorineural hearings are combined at the same time. Causes of hearing loss can be
Just
people.
Ella, hey.
Go ahead. Well, wait a minute.
Keep going.
keep going,
There's
Amanda.
no interruptions. You're
Causes
fine.
of hearing loss are prenatal.
Hello.
In some cases, hearing loss is unknown or
Weird.
unidentifiable, but there are some known causes that have
We're all
been
here
studied
in
for
the
years by
ground. She's giving her
researchers and the
speech.
ENT doctors.
We're talking.
The Encyclopedia of Children's Health and Wellness states that between 7 and 20% of deaf and hard of hearing
Okay.
people lost their hearing before birth. The prenatal
Okay,
causes of
it's
hearing
nice.
loss are most commonly tied to viral diseases such as rubella, influenza, mumps, and herpes simplex contracted by the mother. The fetus is most vulnerable to these infections during the first trimester. Smoking is another cause of hearing loss in the prenatal state. Studies have shown that a mother who smokes or a mother who inhales secondhand smoke regularly triples their child's risk of developing an ear infection at birth. The exposed to the toxins are more likely to suffer middle ear infections and require ear surgery before age 5 than those who weren't exposed. Bacterial meningitis. During an interview with Dr. Edward Shiner, an ENT, he said that bacterial meningitis is one of the most common causes of acquired sensorineural deafness in newborns. In infants, it is usually caused by E. coli. About half of the infants who contract bacterial meningitis will have irreversible, profound hearing loss. The Encyclopedia of Children's Health and Wellness states that the most common cause of hearing loss in the United States is ear infections. These infections lead to fluctuating hearing loss that disappears and reappears from time to time. Factors that influence hearing loss are allergies and illnesses such as colds. Children are prone to ear infections because their tubes are shorter, straighter, narrower, and more horizontal, making it easier for them to become infected. Ear infections cause a sudden, severe earache, hearing problems, ringing in the ears, sense of fullness, and fever. Chronic untreated ear infections can cause hearing loss due to constant irritation. Identifying hearing loss is easy. The American Academy of Pediatrics recommends that every newborn has a hearing test at birth. Parents who recognize hearing loss because their infants don't respond to loud noises can have their child tested with behavioral tests, which includes sitting in a soundproof box and having instructions read to them. There are many solutions to hearing loss today, such as hearing aids and cochlear implants. These solutions may not work because hearing aids and surgery are very expensive and the state doesn't provide funding along with insurance. Most parents don't get their kids tested after the initial hearing test to find out what type they have, so the best fit for a solution usually is not chosen. Researchers continue to find solutions to hearing loss, preventative measures, and advancement in technology to help cure them. The end.
Can I ask a question?
Name the three again.
They're conductive, sensorineural, and then mixed, which is the two of them together.
When did you realize that you had hearing loss, and what type do you have?
Well, I have sensorineural, and that was because in the 4th grade I had a regular infection in swimmer's ear, and it ruptured my eardrum and then healed over wrong, plus genetics. It's slowly going away.
What does ENT stand for?
Ear, nose, and throat doctor.
Now are you healed completely?
No. I will probably lose all my hearing in this ear and then some of
But you're debilitated right now as I speak?
Yeah, I can hear you. Fine.
But are you actually hearing or are you reading lips also? Not knowing that?
If it's loud noises, I have to look at your, like if everybody's talking, I have to look at your lips because it's just when I can hear you good.
Now you find yourself doing that naturally?
Yeah. It's like when she talks through the door.
Only because it's going to help you later in life when you decide